This is Health Professional Radio. I'm Henry Acosta, the host for this segment. Our guest today is Genevieve Nolan of Move Muscle, Bone, and Joint Health. She's been with Move for 11 years, and she is the Programs Manager, Policy, Information, and Programs Unit. So what she does is her sole responsibility is for the coordination of Move's suite of training and educations program. She's joining us today to talk about how Move is the new voice of arthritis and osteoporosis. They are also offering webinars for everyone interested in it. Its aim is to provide participants with meaningful skills and knowledge to deliver recommended care for people with musculoskeletal conditions. With all that said, thank you for joining us today, Jen.
Great. Thanks very much, Henry.
So to kick things off, I just wanted to ask, can you tell us a little bit more about yourself and how you got started with Move?
For me personally, actually, there was just a slight correction there. I've been with Move for nearly 6 years, and I previously worked in the Victorian Department of Health, what's now the Department of Health and Human Services, in a range of positions there. And I just was keen to move into the sort of community-based sector and work more closely on things more, I suppose, at the coalface compared to the work I was doing in the at a government level.
Oh, that's interesting. And can you tell us about Move? What do you guys do at Move, and what do you guys offer?
Well, we are a national organisation, and our purpose is to improve the quality of life for people who have or at risk of developing musculoskeletal conditions. I guess we'd like to sort of consider ourselves, or we think we are definitely the national voice of muscle, bone and joint health in Australia. And of course, our main focus is working with people with muscle, bone and joint conditions, but also with health professionals, because really if the health professionals are delivering evidence-based care, then we know the people that we are trying to help will be receiving the best possible care. So we worked with a whole range of health professionals, people who have the conditions, as we say, also people who are at risk of developing the conditions, and we do that in a variety of ways. We undertake quite a bit of research. We also do extensive policy and advocacy work, and as you mentioned before, I'm responsible for the training and education suite of activities. But most importantly, we have a lot of activities that are very much about sort of providing information and support to people with musculoskeletal conditions. And probably the lead aspect of that is our national helpline, which is staffed by rheumatology nurses that can provide information to people with conditions, but also to health professionals that might be wanting to know a bit more about how to navigate the system and really assist their patients better in their care.
Wow. So if I have any musculoskeletal conditions, I'm going to for sure reach out to you guys.
Yes, that's the place to come to, Henry.
Yeah, and with regards to that, you guys are offering webinars also, am I correct?
Yeah, like for the last couple of years, we have run a suite of webinars for health professionals in the primary health and community health sectors. We're up to, I think, about number 40 over the webinars we've run in the last couple of years, and we're very fortunate getting the support of some very high-profile academics and clinicians to work with us to deliver our webinars. And the webinars we have coming up in the second half of the year, it's actually a really great sort of setup, because we've also been fortunate in getting a bit of funding from AbbVie Proprietary Limited. So we're actually offering 6 webinars in the second half of the year, but for the price of 4.
Wow. That sounds really impressive. And what are these webinars, and what do people usually get out of them?
The webinars run, they're an hour-long webinar. The nice thing about webinars is that if you can't actually view it at the time of the live sort of screening, it can be viewed by recording later on at any time that's convenient. So we always run our webinars on topics that we know will be very relevant to health professionals working with people with musculoskeletal conditions, and they're usually on topics that are burning issues for the people who have the conditions, and also one of the main purposes of the webinars is really to help the health professionals who are working with those patients to know how to better deliver evidence-based care. So, for example, in our series in the second half of the year, we've got webinars on cognitive behavioural therapy and pain, the role of footwear in the self-management of knee osteoarthritis. We've got a webinar on stem cells. Often that's a bit of a burning issue that clients and patients need to know more about. So we've got an expert from Melbourne University providing an update on the latest with regards to stem cell research in the area of musculoskeletal health.
Yeah, and for those people who are interested in listening to your webinars from the past, can they still get access to those?
Yeah, they can certainly. So of all those ones, as I said, we've run nearly 40 over the last couple of years. We certainly the ones that we have run in the last year or two, which we are quite sure that the content is still relevant and up to date. Those are available by looking on our website. So if people go to our website of www.move.org.au, they'll be able to get further information how to access our previous recordings and also to book on our booking for our forthcoming webinars, which will all be listed there.
Wow, sounds great. And yeah, that sounds really impressive how you guys have a database of all your past webinars.
Yes, well, I mean, there's such a valuable resource for health professionals, and as I say, Henry, we're really trying to help health professionals to actually help their patients better. So we know that a lot of health professionals sometimes they're looking for information. They're busy people, so the webinars are a great way of also reaching people in all states of Australia and even internationally. So that's the great thing about the online education. It certainly sort of defies any geographic boundaries.
And yeah, I read here off a press release that you guys offer 2 free webinars for healthcare professionals.
That's right.
Yeah. So, can you tell us about that?
Yeah, so as I said before, of our 6 webinars on offer in the second half of this year, we've been very fortunate in getting some funding from AbbVie Proprietary Limited, who are sponsoring 2 of the webinars to be offered free for health professionals in all states of Australia. We'll have a webinar on the diagnosis and management of psoriatic arthritis, and also another free webinar on the diagnosis and management of rheumatoid arthritis. And they will be screening in October and November this year. And people just need to register for those at no cost. For our other webinars, just to cover our costs and so on, we do charge a fee. And again, those details regarding the costs for the other paid webinars are available on our website for move.org.au.
Awesome. And yeah, well, with regards to your webinars, since it's our main topic today, so people can join the conversation. So anyone who's listening right now, whether it be a healthcare professional or not, they can just go to your website. What else should they know before they get started with the webinars and go into your website? Well,
no, as I say, just to be aware that the webinars are offered at what we consider to be a very reasonable price. So in the second half of the year, we have our 4 paid webinars, but also those 2 free webinars. So there's really no reason why any health professional wouldn't register for those 2 free webinars, and hopefully we'll also register for our other paid webinars. So it's all pretty self-explanatory once you get to the website. And we really feel that the topics do cover a lot of issues that would be very relevant to a healthcare professional delivering their skills and knowledge to the people that they see on a daily basis.
Yeah, and I understand how important that really is. And,
yeah, absolutely.
And yeah, for our last question, what is your main takeaway message for all our listeners right now?
Well, I think the main takeaway message is really, our main purpose, as I said, is to improve the quality of life for people with the conditions and who might be at risk of getting a musculoskeletal condition, which really could be all of us. When you look at the figures of the prevalence of musculoskeletal conditions in Australia these days, it really is quite alarming. And I think for the average healthcare professional, they would see people on a regular basis that would have some sort of muscle, bone or joint condition. So I would just say to people, look, have a look at our webinars. We've got the latest evidence-based information in those webinars, and we're really trying to help the health professionals to help the people that they see on a daily basis.
Yeah, and good thing our main listeners are health professionals. And
that's right.
For anyone who's interested in getting in touch with you guys, what's your email address, and do you guys have a phone number that they can also contact?
Yes, you could call our helpline, which is 1-800-263-265, and speak to one of our staff, our trained staff on our helpline. If there's any particular information just required with regards to the webinars, that person can also put you through to the relevant person here. But as I said before, our helpline has excellent advice and information available to not only people with the conditions, but also health professionals that might be looking for some information about how to work with, or some information they can pass on to their patients.
Awesome. Well, that's all our questions for today, and thank you so much for sharing everything, Genevieve.
No problem, Henry. Thanks very much.
And that was Genevieve Nolan of Move Muscle, Bone, and Joint Health. We just finished talking about their organization, what they do, and what they offer, and their current program with the webinars. If you want to get in touch with them, you can go to www.move.org.au. And if you want to listen to this interview again, or if you want to find more health-related news, medical research, and fitness interviews, you can find us at www.hpr.fm. We're also available on major social media platforms, so don't forget to like and follow us. Audio is also available for download and streaming on SoundCloud, iTunes, and YouTube. This is Health Professional Radio. I'm Henry Acosta,